All right. Welcome to Dueling Scalpels, everyone. I'm your host, Dr. Abhishek Parmar. With me, as always, is Dr. Corey Douglas Campbell. Douglas Corey Campbell.
Corey Douglas Campbell. I mean,
Whatever, man. Just say hi to everyone.
hello.
It's okay. I feel
We're-
your pain. I go by Jinnie, but I'm officially Eugenia Page. And so if someone yelled out Eugenia at the grocery store, I'd have no idea who that is. So
Would your friend of
Wow.
30 years do that to you, though?
No.
That's
No.
you don't feel my pain.
All right. Well, first of all, we have a special guest here. I'm welcoming with us today is Dr. Jinnie Kim Page. Hello,
Okay.
Jinnie. How are you doing today?
Great.
Everyone, I'm really excited to have Dr. Page with us today. She is a board certified plastic surgeon. She practices in Atlanta, Georgia. She specializes in breast surgery, body contouring procedures, facial procedures, and microsurgery, I believe, which is a lot. Jinnie actually went to medical school with Corey and I, and she and I were friends before Corey even came in the picture. Is that right, Jinnie?
Yeah. I mean, every episode when you introduce Corey as your best friend, a little part of me was like, well, I was really close to him too at one point.
That's what
Oh,
Dr.
wow.
Palmer does. He hurts feelings all over, man. Somehow he's made us both feel alienated in being his friend. I don't know how he does that. It's
Yeah.
amazing.
That was
Well-
under 3 minutes, and Jinnie was able to make it awkward.
I also know it's
Jinnie
been
and
like
I
20
should
years
say, Jinnie,
since I've really
Jinnie
hung
and I
out with
were.
you.
I would have said that you were my best friend in medical school for the longer duration, but then Corey came along, and
Yeah,
we drifted
I
apart.
get it. It's fine. I mean,
But you were my first
life was
love
hard,
in
and
med
I guess
school.
that's our segue, right? So let's get into it.
Let's move on. Well, Corey and I were talking, and if you've listened to the podcast, I rely heavily on AI. My best friend Bruce for tactical
Yeah,
selection of guests.
we've both been replaced, Jinnie Kim. So Spruce is the new Corey, and apparently he does a
Wait,
better
is
job at it.
Spruce AI? Like you have
Yes.
a name for your AI buddy?
Well, it's his name. He has his name. He's a
He's giving it a gender. He's giving it a name. It's really creepy, Jinnie.
It's not weird at all. Bruce and I talk a lot, and so I asked him who should we have on the pod. And he's like, well, it should be someone that is interesting and someone that you like and respect and you have a rapport with. We thought about you.
Well, thank you.
It's
I'm honored.
you fascinate. The number of conversations Corey and I have behind your back about you,
Oh,
the
definitely.
number is in the thousands.
Well,
Jinnie is definitely all types of fascinating.
thank you. How
So,
so? Well, let's see what
Um,
makes me fascinating.
oh,
I think you're one of the only actual adults that we know together. That's one thing. At least that's how I feel about it. But Palmer may feel different.
I think, I mean, it's one of the reasons I think we became friends in the first place. I think you see the world through a lens that is very piercing and thorough, and I think you navigate the world differently than the average human being does.
I actually also think your takes on some of these things that we say about medicine would be interesting. So that was another thing. I worry about the future of medicine, and Palmar's on the opposite side of a lot of those conversations. I say, well, what would Jinnie think? Like satisfaction with job satisfaction in
Sure.
medicine, has that changed in the last generation or two?
I think
A
there's
lot
a
of
lot
those
more
things.
transparency now with different modalities like social media, podcasts, like the old school Googling and finding it on various official websites is no longer there, right? Everyone has a
Mhm.
voice, everyone has a platform. And
Mhm.
so you can find out all aspects of medicine, including from, sources like this, where people can share their experiences and why they like it, why they don't like it, why you should try it, why you shouldn't. And so since everyone has a voice, I think people who go into it may have a more realistic idea of what to expect from it. If I went into medicine knowing all of this, I don't know if I would have made the same decisions, but it would certainly be um, more informed of a decision than what I went into. Like growing up, my parents wanted a doctor in the family, and I made that happen. And then somehow my sister and brother both followed suit. And so that was just kind of, either a doctor or engineer. Like those were our only two choices. And so I didn't really know anything about this. And then when I went into medicine, it was always like, follow your dreams. It was never, well, if you could do it this way, you can make X amount of money. If you do it this way, like your lifestyle would be amazing. Like no one really went into that. It was just find what you're passionate about and just follow your dreams. That's it.
So your parents
And
told you to
so
follow your dreams?
my parents told me to be a doctor. And then once I went to doctor school,
But
I feel
follow
like
your
the
dreams
message
as long
was,
as it's an engineer or a doctor.
yeah, of
Those are the
course, that's the
dreams that are
Asian
allowed to
way.
be had.
That's the
Let's
Asian
that's good
way.
actually because one of the questions I had is, did you always know you wanted to be a surgeon and a plastic surgeon, or when did that
No.
happen?
So I was a neuroscience major. I was in a lab in undergrad and I studied mind and brain, so neurophilosophy. I always thought, and part of that was through visual systems research. And so I thought I would go into either neurology or ophthalmology. And then my very first day of med school, when we were in anatomy lab, I just was like, what is this? This is so fun. And so I don't know if you guys remember, but after we would go home and eat dinner, which was typically spaghetti and meatballs, which I didn't realize had like 2,400 calories a day or per meal until nutrition class. But anyway, I ate spaghetti and meatballs every day. I don't know if you guys realized that I gained like 15 pounds my freshman year or whatever, first year. Anyway, so after I would eat, I would take my Sony Discman, and at the time I had two CDs. One was Maroon 5 and the other one was John Mayer's CD. So I would take one of those two CDs and I would bring that back to the cadaver lab, and from like 7 p.m. till 10 p.m. I would go around the cadavers and listen to music and learn. So that was what I did. I don't know if you guys knew that, but I
Well,
fell in
we didn't
love
do
with
that because
anatomy.
we didn't do that because you were there and didn't see us. So no, we didn't do that.
So
We were
I
doing other things.
you were becoming best friends.
Yes. Yes. We were not
Oh, I didn't know Corey existed first year. I think it was between first and second year where we met,
Yeah,
right?
so I mean, I fell in love. It was love at first sight. Like the human anatomy, human body was fascinating to me. And so then, um, you know, I tried out neurology briefly, wasn't that into it. And then ophthalmology freaked me out because I was in a dark room, face to face with a stranger all day. And I have like borderline narcolepsy where if I just sit still for a while, I'd fall asleep. And so it just wasn't the right field for me. So, um, I tried those out just to eliminate them, or at least just to say that I did. But pretty early on, I knew surgery was it for me.
Yeah, that's uh, for those of y'all listening. Like, I think that little anecdote. I think typifies Jinnie Kim to me is that there are a lot of I think tropes, and Corey and I have talked about in pop culture how certain doctors and physicians are depicted, but there's always someone that kind of I don't want to say the pejorative term is a gunner, which we've said, but someone who's like just, I mean, like no one asked you to go and listen to music and study more. Like you're just
It was
passionate
just
about it. And like,
fun. It was
yeah,
so
like you just,
cool.
there's always that one character I feel like in any given show that is just like, I don't know, is a little bit more dedicated than anyone else, a little bit more engaged, a little bit more intelligent. To me, I feel
Yeah,
like
it's like
that's Jinnie Kim.
yeah, Jenny Kim's is a character in House where they are dedicated and there's a competition and I don't know, maybe I missed the memo on that one, but that's why it's always interesting to hear your perspective on things because there is I mean first of all we all were dedicated, but your dedication, as you has shown, you're in the lab by yourself with your Walkman right after dinner, and there's not a lot of people there, right? There's like maybe a handful of
Yeah.
people.
Yeah,
So,
no, it was pretty empty. But like what was so cool was, I played music, I played piano all my life, and what I learned was like three nerves were responsible for all the intricate things that our hands could do, like how beautifully simple is that design that was given to us, right? Like if we were to create a robot to do all of this, it would be way more complicated than that. We can't make anything this anatomically efficient and perfectly designed. And so when I realized, not to get like spiritual or religious about this, but like it was just so beyond what I imagined I was getting myself into, you know? Didn't know
Yeah,
that that
definitely.
was what I would get when I went to med school.
Spruce says that plastic surgery sits at the intersection of engineering, artistry, and medicine, which I think kind of touches on. I mean, you said it more beautifully than he did. He's a he, by the way, Spruce.
That's probably
But
why.
so
Just kidding.
what which part of those do you enjoy the most?
Um, so I feel that every day, right? So the world can exist without plastic surgeons, and maybe a little with reconstructive surgery. We are a little bit necessary to cover big holes, but in general, a lot of what we do is completely elective. A big portion of my practice is reconstructive. It used to be more like 80 to 90%. Now it's more like 60 to 70% reconstructive. I recreate body parts from different body parts in our, like making new breasts, covering a big hole, moving legs over, like thigh tissue to cover a big hole somewhere else, moving a back to cover a scalp. Like moving body parts is a big part of what I do. But the artistry part is so fun. So I was thinking about this the other day, like if you commission an artist to paint you a self-portrait, or not a self-portrait, paint you a portrait of you and your family, let's say. They may take 4 weeks, 6 weeks, 2 weeks, I don't know. They can take all the time that they want. But for us, patients have paid us to put them to sleep, and you have a very limited time to get it perfect. And the value of your work or the success of your work is visible to the entire world and will be scrutinized by that patient. So Abish, if you were in the OR and they asked you to do a ventral hernia repair robotically and you did it beautifully, no one may know how elegantly you did it, right? And all they know is that you fixed it, but they don't know like how smooth you were under the robot. Only you get to enjoy it and the people around you. For me, my entire work is visible to the patient. And so it's that time factor of like, you have 90 minutes to get this perfect, or else everyone in the world will know. Like that's a different kind of stressor and
Mm.
challenge. But it's fun. It's one shot. You get one shot to get it right.
Like what you said about you, like somebody commissioning an artist for like a portrait or something, because that kind of ties into what I would say would be where reality sets in as far as your job in today's world. Like you said, there's a lot of transparency. You get rated as if you're a KFC or a Uber driver, and I don't know if you feel that because, like you said, like the idea is like there's an interpretation of what you think this should look like for this person, right? If they're not on board with that, then you get 3 stars, right, or 2 stars, and how do you feel about that? Because that's what the reality of you are offering a service versus at the same time it's a service that has an artistic element to it. Meaning, like,
Yeah.
how do you square that with yourself?
So, so, occasionally people will ask me what my favorite case to do is, and my answer is always whatever case makes the patient happy. So I can do what I feel is the most perfect tummy tuck. And if the patient is not happy with it, it is not a successful surgery, right? The endpoint is subjective. And so that's the hard part of my job. It doesn't matter how technically perfect it went on my behalf, but if the patient is not happy with the outcome of it, the aesthetic outcome of it, or whatever she had in her mind. So my job is to make sure that my expectations of what I predict I'm able to achieve is aligned with the patient's expectations or goals. And if that's not a good fit, I have to let them know that either I'm not the right person for them or that their expectations may need to be molded to something that, you know, is a little bit different in my hands. And I always say this is just I'm not a magician. I am one human being. I'm one surgeon, and mine is just one take at it. And so I recommend patients to get second, third opinions because this is elective. They have a lot of money and resources and time off work and expectations and hopes that are invested in this. And so I always want to make sure that they feel 100% excited that they're ready for this surgery, that I am the person to do it, and that our expectations are aligned. That's the only way that you can really get success.
I, I have the exact opposite feel of what I'm put on earth to do as a surgeon. No, for the most part, general surgery is a lot, well, 80-90% of it's probably non-elective, right? It's just things that people have to have done for health, for survivability, for pain relief, or whatever. I said, as opposed to you, where you want to like engage a patient and have them remember you and remember the work you did on their behalf. For me, I don't. I
Yeah,
actually think the best general surgeon is somebody you forget because you forget the whole experience because it's like, oh yeah, you
yeah,
remember I did have that problem.
yeah,
What was that guy's name? Because the idea is you want it to be such a non-entity in somebody's continued life that it happened. It was an episode. We went through it, and then you forgot about it. But yeah, I don't have an appendix. I remember now. I don't remember who took it, but I don't have one now. Or yeah, you know what? I had a gallbladder taken out. When was that? Where was that? Does anybody remember? That's the best situation for a general surgery 9 times out of 10 because 9 times out of 10, the problem is something nobody wanted to think about twice. And if that's where it winds up being when it's all said and done, I think you've done an excellent job because they don't think about the scar, they don't think about the pain, they
yeah,
don't think about you. But like I said,
yeah,
your role in people's lives is a 180 from that. They want to remember
yeah,
this
Well,
decision
I
as
think
a good
you're
one.
Ginny. I think what you're talking about the artistic element is interesting because it's been studied that there's a psychological element to what surgeons do as far as their preparatory practice. And I think all of us do this whether we realize it or not. When you're planning a case, you're walking to the operating room, you walk through the steps in your mind of exactly what's going to happen. And so for Corey, for bariatric surgery, again, this is the step XYZ. Most of the time, it seems like it's very prescribed. For what I do, robotic hernias, most of the time it's very prescribed. Maybe there's a little bit of iterative element to it, like, oh, they've had a recurrence or someone's fixed this before, something's a little different. So, but for you, do you think there's a very large part of it that's iterative? Like, how much of your operation do you think is improvised versus you knew exactly what was going to happen going in and it
Um,
looked just the way it did in your mind's eye?
that is a great question because I talked to my husband Andrew about this because he's also a surgeon. So, um, for my reconstructive practice, I don't know what I'm going to get ever. So, for example, if I'm following a lumpectomy for breast cancer, where they don't take the whole breast, but they take part of it, and my job is to fill in that hole and lift the rest of the breast to make it look pretty and normal as if no one was ever there. So sometimes the hole is somewhat small, but sometimes I go in and there's like a watermelon sized hole going across the middle of the chest, and I'm left with like side boob and skin, and that's it. Like, how am I supposed to close this? How am I supposed to make this look like a breast, right? And so that is my everyday. Like I don't know what kind of skin flaps I'm gonna get. I don't know how wide they're gonna go for the mastectomy, how high they're gonna go, if that skin's all falling apart and dying. Like I don't know what I'm gonna get. And so I mean, now that I've done it for many years with certain people, I know I'm gonna get this versus that. But in general, a lot of my job is on the spot thinking. And so that may be very stressful for some people, but I love the creativity that is required for the reconstructive part because I just don't know what I'm going to walk into. And so troubleshooting on the spot is really fun because, if I'm doing the same breast augmentation every single day for the rest of my life, it would be so boring. Um,
Agreed.
Facelifts, like the skin's or like the neck is sometimes super fatty, sometimes it's, not like it. I feel like everyone's face and layers are all so different. And so what I get, even though the surgery is the same, the anatomy is just so different from person to person, that one tummy tuck versus another one, it's not the same. Like some people, I have to snatch it in more from the side and do some lipo. Other people, I just pull straight down and it looks perfect. Like every case is so different.
Yeah, and I agree, and I think that's the operations that I enjoy the most, the ones where I know there's gonna be some challenge, I don't quite know 100% what I'm gonna get into, but you have this wealth of experience over years of practice and training, and this is why I teach the residents all the time, it's like, I haven't seen this exact scenario, but I've seen 15 similar circumstances, and the average of my mind is, we're gonna run into, X, Y, or Z, right? So the other thing I wanted to ask you about, so you did mention two sort of branches of what you do, the cosmetic side and the
Mhm.
reconstructive side. Well, first of all, you want to explain that for our friends out there, and where do your
Yeah.
passions lie, and where have you learned the most, and which side of things?
So, the cosmetic side is what most people think about when they think plastic surgery, like boob jobs, tummy tucks, BBLs, facelifts, like that kind of stuff. So the cosmetic side is a cash only enterprise where you name your price and the patients will sign up for it based on either your reputation or a friend they knew went to you or your before and afters or your social media presence or whatever it may be. And unfortunately, so much of that is so fake, right? Like you can have great marketing and some people will even steal other surgeons' before and afters and have a facade that you are a very experienced and polished plastic surgeon. Not even a plastic surgeon, maybe a cosmetic surgeon. Someone who was an OBGYN, an ER doctor who never went to plastic surgery training. They did a 1-year cosmetic fellowship with someone who would take the money for it and trained you for a year. And so you have dermatologists doing tummy tucks and breast dogs and OBGYNs doing all these things too. So they call themselves board certified because they are in OBGYN or in emergency medicine or some other field, but they are not plastic surgeons or cosmetic surgeons. So anyway, cash pay. Money makes people do weird things. Money makes good people and smart people do weird things. It's weird. So
Mm.
when Kris Jenner got her facelift, the guy who did it in New York, um, the going price for a facelift used to be like 20 to 50,000, let's say. And then over the last 5 years, it went to like 100 to 300,000 for a facelift. And now we're looking at 500 to a million for a facelift for some people for one surgery. It's insane. And so, some part of plastic surgery has become like a status symbol for some people. And so if you go to this person, um, that's a status symbol for you. Like I got my face done by so and so. Because everyone knows how much they cost. So I can be a nobody and I can just randomly name a price for my breast work. And yeah, if I put a price tag of 50,000 for a breast dog and it happened to be okay for a number of people and all of a sudden it's like so desirable because it's so hard to get, right? And so I don't enjoy that aspect of plastic surgery. And so my pricing has always been normal and average because I don't like that uh inflation or that game. It's gross to me. Um but I enjoy it because in general, it has low complications, but it also is in healthy patients who want to restore a part of their life that they felt like they have been missing for the last 10, 20, 30 years. So, Abish, you have children. And as someone for myself, having gone through 3 pregnancies, after pumping for 27 months total of my life with some machine that's like sucking milk out of my boobs, like it does a number on my body, right? So my belly, my breasts, so I get it. Like I can see why women after their 30s and 40s want to do something about themselves because they used to not look like this, you know? And it's really hard, especially for people who may have been fit, may have been like super hot or attractive. Like it's really hard to see their bodies look nothing like what they feel. So helping people regain themselves is a really fun part of my job. But the other part, the reconstructive part, so reconstruction is what people think about when insurance covers medically necessary procedures. So, whether you have a skin cancer and got half of your face chopped off, or you had some sort of bad cancer on your arm, or maybe a big trauma where half of your chest was shaved off, or whatever, like when you have some big problem and we need to cover it to let it heal, or to restore a body part, or make one from scratch, like that is reconstruction. And so, a big part of my practice is breast cancer reconstruction. There are people who do lower extremity reconstruction after trauma, some that do craniofacial trauma. I focus on breast reconstruction. And so part of mine will be implant based. Some of it is tissue based, where I move body parts from belly or thighs to the breast. So that's reconstruction. I love that because, you know, and this may segue into whatever you want it to, but when I was in residency for plastics, my oldest child was diagnosed with metastatic cancer when he was 4. And going through that process of um, cancer treatment in the hospital for almost 3 years straight, we went through 2 years of chemo, immunotherapy, bone marrow transplant, 13 surgeries, 18 weeks of radiation, a lot of shit. And that was really hard to do as a parent, but also as a resident too. And so, having gone through that as a physician, to understand all the gaps in healthcare where empathy from the providers is sometimes lacking and patients become just a number to check off, like a box to check off with rounds or whatever it may be. That was really frustrating. And for breast cancer patients, this is a very unique time in their life where they are scared, they're angry, like this is, no one wants cancer. There's never a good time for it. There's never a convenient time for this. So when you're 30, 40, 60, whenever, wherever you are, when you're diagnosed with it, it is a slap in the face. And then you have to like sit and work through all of your emotions. And so to feel like I can take a part of my practice and be a foundation for these women who are falling apart, um, it's so meaningful to me because I went to medicine to be a doctor, right? Like I didn't go to be a businessman or to make like millions and millions of dollars. I went to be a doctor. And so that's really meaningful to me and rewarding, so that for a really weird time in some women's life where they're scared and they may lash out at us because they're projecting their fears and everything and they just don't know how to process it, but I get it. And I feel like for most people I can relate with them and understand where they're coming from and help them through a really tough time.
Yeah, I mean, you know, you're incredible, Jenny. You're a lot of things, but one of the things you've always struck me as is resilient. Like medical school is tough, residency is tough, fellowship training's hard, and being a surgeon is challenging. All those things are tough, but and to add on top of that, the personal struggles you mentioned with your son and everything you've been through. Um, yeah, I don't know, you've always struck me as just being, like, really resilient, and that's kind of the buzzword in, I think, probably any field, medicine especially, and surgeons and the residents, the medical students want to be, "How do I become a surgeon?" I'm like, "Be resilient, have grit." That's the buzz term. Do you agree with that characterization, or how did you get it?
Oh,
Or
So I think part of this answer is what I teach my kids, but whenever you're given a situation, whether someone says something to you or does something to you or something just happens, you don't have control over that situation happening, but you have control over your response to it. And so if someone's yelling at you, that may anger you, but you don't have to respond in anger, right? And so the only thing you have to control is your response to it. And so, you know, today I was talking to Edward about my oldest about he hates to sing in front of me, and he will not sing in front of me. And I asked him, is it because I know he can't. He has perfect pitch. Like, I know this boy can sing, but he will not do it in front of me. So I asked him, are you not singing in front of me because you don't want to, or because you think I will be judging you? I was like, because you'll be judging me. And I was like, so let's extrapolate this in life. If you let fear of failure keep you from doing things, you won't be able to do the things you want to do. But if you let failure fuel you, you will get so far in life because you don't get anywhere just by succeeding all the time. You fail over and over and over again. You see challenges over and over again. If you let that bring you down, then the road stops right there. But if you let that fuel you and launch you into either new adventures or moving past that or whatever it may be, you only get stronger. And so, I don't know, resilience, was it a choice? Was it something I was born with or taught? I don't know. I feel like I didn't really have a choice in the matter of what happened, but I feel like I could either say, I could either let it stop residency training. I mean, I was already 9 years into training by then. I had 2 more years left, and I could either stop there or I could just finish it up, right? And so, my mother-in-law, we would not have been able to do any of this if she hadn't been there every single day during his hospitalizations. She would be there from like 4 a.m. until whenever Andrew or I came to the hospital. And he and I, whoever was not on call, would go to the hospital to stay with him. And so we were up with him all night and then go to work the next day. And in 4 a.m., she would come in. We would shower in the hospital, be ready to leave at 4, and she would get there, and then we would go to work and then come back whenever we were done for the day. So, like, that's how
Uh-huh.
we lived for 2 years.
So Marcus Aurelius, one of the great Stoic philosophers. I don't know if you've read Meditations, but his line is, if you choose to be unharmed, you are unharmed. So I've read a lot of Stoicism over the past few years, and what you're saying resonates, and I agree. But I also just like yelled at my daughter because she was sitting in front of me while I was watching TV. Get the hell out of the way! And then she yelled back at me. And I teach my kids the same elements to, the only thing you control is your reaction to the world around you. But you actually do it, and I think that's the deciding line. It's one thing to understand it and say it.
All right.